If you are over the age of 70, or you are caring for someone in this stage of life, knowing the early warning signs of heart disease is not just useful, it can be life-saving. Many older adults do not experience the dramatic chest pain we see in movies. Instead, the signs can be subtle, confusing, and easily mistaken for other problems such as aging, stomach issues, or even stress. Today, let us focus deeply on the first two warning signs: shortness of breath and chest discomfort. The first warning sign is shortness of breath. In medical terms, this is called dyspnea. At first, it might seem harmless. Maybe you notice you get winded more quickly when climbing a few steps, or you need to pause halfway down the hallway. But in seniors, especially those over 70, this can be much more than just getting older. It can be one of the earliest signs of heart failure or a heart attack. Unlike younger adults, where chest pain is common, older adults often present with breathlessness as the main symptom. Imagine this. You used to walk to the garden every morning with no trouble, but now, after only a few steps, you feel like you have run a mile. Or perhaps you notice you can no longer sleep comfortably lying flat. You find yourself propping up with 2, 3, even 4 pillows. Some people even move to a chair at night because the moment they lie back, they feel like they are suffocating. These are not normal parts of aging. These are strong warnings that the heart is struggling to pump blood effectively. Another red flag is when shortness of breath wakes you suddenly in the night, gasping for air. This is known as paroxysmal nocturnal dyspnea, and it is highly linked to heart failure. Some people also notice a persistent cough or wheezing that worsens when lying down. Often, they think it is asthma or lung disease, but in many seniors, the underlying problem is the heart. So, when should you worry? If shortness of breath is new, if it is getting worse, or if it is interfering with simple daily activities such as bathing, dressing, or walking around the house, it is time to see a doctor. And if the shortness of breath comes on suddenly and severely, or if it is paired with chest discomfort, fainting, or coughing up pink, frothy sputum, do not wait. Call emergency services immediately. Caregivers, pay attention to subtle changes. If your loved one who used to walk easily now avoids activity or needs to stop more often, write it down with dates. These small details help doctors adjust treatment before the situation becomes dangerous. Now, let us turn to the second major warning sign: chest discomfort. When people think of heart problems, they often imagine stabbing chest pain. But in seniors, chest symptoms are often very different. Instead of sharp pain, many older adults feel pressure, heaviness, squeezing, or tightness. Some describe it as though a belt is tightening around their chest or an elephant is sitting on it. But others, especially women and people over 70, may not feel chest pain at all. Heart disease in seniors can masquerade as indigestion, acid reflux, or even muscle pain. A 72-year-old woman may complain of upper stomach burning after dinner, when in reality she's experiencing angina or restricted blood flow to the heart. Another person may feel discomfort in the jaw, the neck, the shoulders, or the upper back. These unusual or atypical symptoms are a big reason heart attacks are often missed in older adults. To understand whether discomfort is heart-related, it's important to look at the context. Does it appear during activity, such as walking or emotional stress? Does it ease with rest? Does it come with other symptoms like breathlessness, nausea, weakness? If the answer is yes, it is time to take the situation very seriously. Doctors recommend that if you or your loved one experience new or repeated episodes of chest discomfort, especially if it radiates to the jaw, neck, back, or stomach, you should contact a healthcare provider promptly. But if the discomfort lasts for more than a few minutes, or if it disappears and then comes back, do not wait. Call emergency services right away, especially if it is paired with sweating, dizziness, or shortness of breath. Remember, seniors often have delayed or silent symptoms, and every minute matters when it comes to protecting the heart muscle. As a caregiver, one of the best things you can do is to ask very simple but direct questions in the moment. Where exactly does it hurt? Does it feel like pressure or stabbing pain? Did it start while resting or moving? What else are you feeling? Shortness of breath, nausea, weakness? The answers to these questions provide crucial information for doctors and emergency teams. Shortness of breath and chest discomfort are the two most urgent signs of heart disease in people over 70. They often appear together, but they can also occur separately. Both are easy to dismiss, yet both can be deadly if ignored. Recognizing them early and acting quickly can truly save a life.
The third warning sign of heart disease in seniors over 70 is swelling in the legs, ankles, or feet. Many people think swollen ankles are simply a part of aging, or perhaps caused by standing too long. But in older adults, especially those with heart problems, swelling, known medically as edema, is often a signal that the heart is not pumping blood effectively. When the heart weakens, blood returning from the body begins to back up in the veins. This extra pressure pushes fluid out of the blood vessels and into the tissues, particularly in the lower body. That is why swelling tends to show up in the feet, ankles, and calves. Sometimes the swelling is mild, only noticed by tighter shoes or socks, leaving deep marks on the skin. Other times, it can be quite dramatic, with legs that feel heavy, stiff, and uncomfortable. What makes this especially concerning in seniors is that swelling often develops slowly and quietly. A person may not even realize it is happening until a caregiver points it out. You might notice that their slippers no longer fit, or that their socks leave deeper indentations than before. The skin may appear shiny or stretched. In more advanced cases, pressing a finger on the swollen area leaves a noticeable dent that takes time to fade. Swelling is not just a cosmetic issue. It is a strong signal that fluid is building up in the body because the heart is struggling to circulate blood. Left untreated, this fluid can accumulate in the lungs as well, worsening shortness of breath and leading to dangerous complications. When should you worry? If swelling appears suddenly, if it worsens quickly, or if it is accompanied by shortness of breath, chest discomfort, or weight gain of more than 2 to 3 pounds in a single day, it is time to call a doctor right away. If the swelling is severe, painful, or associated with breathing difficulties, do not wait. Seek emergency medical care. For caregivers, it can be useful to monitor leg size daily or keep track of weight, because rapid changes can be one of the earliest warnings of worsening heart failure. Now let us look at the fourth important warning sign: unusual or persistent fatigue. Fatigue is common as we get older, but there is a difference between normal tiredness and the overwhelming exhaustion linked to heart disease. In seniors over 70, the heart may not pump enough blood to meet the body's needs, especially during activity. As a result, muscles and organs do not receive enough oxygen and nutrients. This can leave an older adult feeling drained, weak, or unable to complete simple daily tasks. For example, a person who once enjoyed gardening may suddenly find themselves too tired to water the plants. Walking to the kitchen may feel like climbing a mountain. Even after a full night of sleep, they may wake up exhausted. What makes heart-related fatigue unique is that it often worsens with activity and improves with rest. A senior may feel fine sitting in a chair, but become extremely tired after light chores such as folding laundry, bathing, or cooking. This kind of fatigue is not normal aging. It is a warning that the heart is under strain. In some cases, unusual fatigue is one of the earliest signs of an impending heart attack, especially in older women. They may not experience chest pain at all. Instead, they simply feel unusually tired for days or even weeks before the event. Unfortunately, many seniors and caregivers dismiss this exhaustion as stress, poor sleep, or just getting old, when in reality, it is the body's cry for help. When should you worry? If fatigue is new, persistent, or out of proportion to the level of activity, it deserves medical attention. If it suddenly becomes severe, or if it comes together with shortness of breath, dizziness, or chest discomfort, emergency services should be contacted immediately. For caregivers, the best way to catch this symptom is to listen closely when your loved one says, "I feel too tired to do anything," or "I don't have the energy I used to have." Encourage them not to ignore it. Write down when the fatigue started, what activities make it worse, and whether it is accompanied by other symptoms. This record can help doctors find the cause quickly and prevent serious complications. Swelling in the legs and unexplained fatigue may seem like ordinary problems of old age, but in reality, they are powerful warning signs of heart disease.
The fifth warning sign of heart disease in seniors over 70 is palpitations or irregular heartbeat. Many older adults describe this as a fluttering, pounding, or racing feeling in the chest. Some say it feels like their heart skips a beat. Others describe it as the heart beating too fast, too slow, or unevenly. While occasional skipped beats can be harmless, frequent or sustained irregular rhythms in an older adult are often linked to serious heart conditions. One of the most common rhythm problems in seniors is atrial fibrillation, often called AFib. This condition causes the upper chambers of the heart to beat irregularly and ineffectively. AFib is especially dangerous because it can increase the risk of stroke by allowing blood clots to form in the heart. For someone over 70, this risk is even higher. Real-life signs include feeling dizzy or lightheaded during these episodes, shortness of breath, or chest discomfort. Some older adults may not feel the fluttering at all. Instead, they just notice weakness, fatigue, or confusion. Caregivers should be alert for any reports of the heart racing or for sudden episodes of faintness or near fainting, as these may indicate an irregular heartbeat. When should you worry? If palpitations are new, frequent, or come with other symptoms like shortness of breath, dizziness, chest pain, or fainting, it is essential to contact a doctor. If an irregular heartbeat is sudden and severe, or if it is accompanied by chest pressure or collapse, it is a medical emergency. A rapid, uncontrolled rhythm can prevent the heart from pumping blood effectively, leading to cardiac arrest. For caregivers, one useful check is to gently feel the person's pulse at the wrist. If the rhythm feels irregular or the beats seem unusually fast or slow, make a note and inform the healthcare provider. Documenting when the palpitations occur, how long they last, and what the person was doing at the time provides doctors with valuable clues for diagnosis. Now let us move on to the sixth warning sign, dizziness or fainting spells, also known as syncope. Many seniors experience occasional lightheadedness when standing up quickly, but repeated dizziness or sudden fainting should never be ignored. In people over 70, these episodes are often related to heart problems. Why does this happen? When the heart cannot pump enough blood to the brain, blood pressure may drop suddenly, causing dizziness or even loss of consciousness. This can occur during abnormal heart rhythms, severe valve disease, or advanced heart failure. Sometimes fainting may be the very first clue of a dangerous heart condition. Imagine an older adult standing up from their chair and suddenly collapsing. Or perhaps they feel fine, then without warning, they black out while walking across the room. These are not just accidents or weakness due to age. They can be life-threatening cardiac events. Even milder forms such as feeling lightheaded, unsteady, or experiencing blurred vision when standing or walking can point to reduced blood flow from the heart. In seniors, this symptom is particularly dangerous because it not only signals heart disease, but also increases the risk of falls, fractures, and loss of independence. When should you worry? If dizziness or fainting happens repeatedly, or if it is accompanied by chest discomfort, palpitations, or shortness of breath, you should seek medical evaluation right away.
And if someone loses consciousness suddenly, even for a short time, treat it as an emergency. Call for help immediately. Caregivers should pay close attention to patterns. Does fainting occur during activity, after standing up, or without any warning? Does dizziness happen only once in a while, or is it becoming more frequent? Writing down the details can guide doctors toward the correct diagnosis and help prevent future episodes. Palpitations and dizziness may sound less alarming than chest pain or shortness of breath, but in seniors over 70, they can be just as dangerous. Both are warning signs that the heart is struggling with rhythm or circulation. Recognizing these symptoms early is key to preventing stroke, falls, or sudden cardiac arrest.
The seventh warning sign of heart disease in seniors over 70 is sudden weight gain and fluid retention. Many older adults and even caregivers overlook weight changes, thinking they are due to diet, reduced activity, or simply normal fluctuations. But in reality, gaining more than 2 to 3 pounds in just a day or more than 5 pounds in a week can be a red flag for heart failure. Why does this happen? When the heart is too weak to pump efficiently, fluid builds up in the body. We already mentioned swelling in the legs and ankles, but this fluid retention also shows up on the scale. A sudden increase in weight often reflects hidden fluid collecting in the body, sometimes even before visible swelling appears. This is why doctors often ask heart patients to weigh themselves every morning. For seniors, this is especially important. Imagine a 75-year-old weighing themselves daily. On Monday, the weight is 140 pounds. On Wednesday, it is suddenly 144 pounds, even though eating habits haven't changed. That 4-pound jump is unlikely to be fat. It is retained fluid, and it could mean the heart is getting weaker. Caregivers should treat unexplained rapid weight gain as an urgent warning. It may indicate that fluid is building up in the lungs or other organs, putting the person at risk of severe shortness of breath and hospitalization. Keeping a simple notebook or using a digital scale with date records can help track patterns. When should you worry? If weight increases by more than 2 or 3 pounds in a single day or more than 5 pounds in a week, contact a doctor immediately. And if this weight gain is accompanied by shortness of breath, chest comfort, or severe swelling, it is time to seek emergency care. Daily weighing at the same time each morning, ideally after using the bathroom and before eating breakfast, is one of the simplest and most effective ways for seniors and caregivers to monitor heart health at home. Now let us move to the 8th important warning sign, sleep-related breathing problems, particularly waking up breathless or having episodes that resemble sleep apnea. Many seniors think poor sleep is a normal part of aging, but disturbed breathing at night is often linked to heart disease. One common problem is paroxysmal nocturnal dyspnea, where a person wakes suddenly in the middle of the night gasping for air. This is caused by fluid shifting into the lungs while lying down, overwhelming the already weakened heart. Another sign is orthopnea, the need to prop up with multiple pillows to sleep comfortably. If you notice a senior cannot lie flat without struggling to breathe, this is a serious heart-related symptom. There is also a close connection between heart disease and sleep apnea. In sleep apnea, breathing repeatedly stops and starts during sleep. For older adults, untreated sleep apnea not only worsens fatigue and confusion during the day, but also strains the heart at night. Over time, this can lead to high blood pressure, heart rhythm disturbances, and worsening heart failure. Real-life signs include loud snoring, restless sleep, frequent awakenings, or waking up choking or gasping. Caregivers may notice that the person seems excessively sleepy during the day, despite spending many hours in bed. These are strong clues that the heart and lungs are under stress at night. When should you worry? If someone frequently wakes up breathless, needs several pillows to sleep, or shows signs of untreated sleep apnea, medical evaluation is crucial. These symptoms are not just inconveniences, they are signals of potential heart failure or other serious heart conditions.
Caregivers should pay close attention to sleep patterns and nighttime complaints. Keeping a sleep diary or even observing the person during rest can reveal important clues. Remember, poor nighttime breathing can silently strain the heart and dramatically increase the risk of hospitalization. Sudden weight gain and disturbed sleep breathing are often silent warnings. They may not feel as urgent as chest pain, but they reveal that the heart is struggling and the body is retaining fluid. Addressing them early can prevent worsening heart failure and improve both quality and length of life for seniors.
The ninth and final warning sign of heart disease in seniors over 70 is confusion, memory problems, or sudden changes in thinking. This symptom often surprises people because we usually connect heart disease with the chest, the lungs, or circulation. But the brain is one of the first organs to suffer when the heart is not delivering enough oxygen-rich blood. In older adults, reduced heart function can cause a decline in mental clarity. Instead of chest pain or obvious breathlessness, a senior may suddenly seem more forgetful, disoriented, or unusually irritable. They may have trouble following conversations, remembering simple things, or even performing daily tasks they once managed easily. Sometimes caregivers notice that their loved one appears foggy, moves more slowly, or seems unusually sleepy during the day. Why does this happen? When the heart is weak or irregular, less blood reaches the brain. Even a small drop in circulation can cause noticeable changes in thinking and alertness, especially in people over 70. Confusion can also occur during episodes of heart rhythm disturbances, when blood flow to the brain is briefly interrupted. In more severe cases, poor heart function may lead to delirium, sudden, severe disorientation that comes and goes. Caregivers should take this very seriously. Too often, confusion in seniors is dismissed as just old age or early dementia, but in many cases, it is actually a red flag for underlying heart disease or poor circulation. When a normally sharp senior suddenly seems lost, forgetful, or unusually tired, it is important to look deeper. When should you worry? If confusion appears suddenly, worsens quickly, or is paired with shortness of breath, chest discomfort, palpitations, or fainting, it may signal a medical emergency. Even mild but persistent changes in memory, focus, or alertness should be discussed with a doctor. Keeping notes on when the changes began, how long they last, and whether they come with other symptoms will help healthcare providers identify the root cause. Now, let us bring everything together. We have discussed 9 key warning signs of heart disease in seniors over 70. These are shortness of breath, chest discomfort, swelling in the legs, unusual fatigue, palpitations, dizziness or fainting, sudden weight gain, sleep-related breathing problems, and confusion or memory changes. Each one on its own may seem minor or easy to explain away. Together, however, they paint a clear picture that the heart is under stress. The most important message is this: heart disease in older adults often looks different than it does in younger people. The classic crushing chest pain is not always present. Instead, symptoms may appear as breathlessness, fatigue, swelling, disturbed sleep, or even confusion. Because of this, many seniors and caregivers miss the early warnings, losing precious time for treatment. But there is good news. When these signs are recognized early and when medical care is sought promptly, treatment can make a major difference. Medications, lifestyle adjustments, and proper monitoring can help stabilize the heart, prevent emergencies, and improve quality of life. For seniors, do not ignore new or unusual symptoms. Trust what your body is telling you. For caregivers, be observant. Write down what you see, and never hesitate to call for medical advice when something feels wrong. Remember, if symptoms are sudden, severe, or combined,
such as chest pressure with shortness of breath, fainting, or confusion. Do not wait. Call emergency services immediately. Heart health after 70 is about awareness, quick action, and steady care. Recognizing these 9 warning signs could be the difference between a serious crisis and a life saved. If you found this information helpful, make sure to share it with your family and friends, because awareness can truly save lives. Take care of your heart. Listen to what your body gives you, and never ignore these 9 important warnings. Stay informed, stay healthy, and always put your heart first.